So today we start urinary system. The first topic in urinary system is nephrotic syndrome, that is related with kidney. So this is your excretory system. This is your excretory system. These are two kidneys, bean-shaped ureters, which open into urinary bladder, which continues as urethra. So this is your excretory system: kidney, ureter, bladder, and urethra. Then renal arteries, which are arising directly from the aorta. So blood supply of kidney is renal artery, which is arising from aorta, and vein is drained by renal vein. So renal artery, renal vein, and this renal vein empty into inferior vena cava. This renal vein empty into inferior vena cava. So kidneys, these are a pair of excretory organs situated on the posterior abdominal wall above the waist, that is in the loin area. The position of kidney is in the loin area. See, this is the position of your kidney in the loin area, extending from upper border of T12 to L3 vertebra. So its location is T12, means 12th thoracic vertebra up to the third lumbar vertebra. That is the position. T12 means 12th thoracic vertebra up to the third lumbar vertebra. So extending from upper border of T12 to L3 vertebra, and it is partially protected by 11 and 12 pairs of ribs. So it is protected by 11, 12 pairs of ribs. This is the loin area, the area of the kidney protected by ribs. The level is from T12 to L3. These are bean-shaped organs. These are paired retroperitoneal bean-shaped organs located in the dorsal upper lumbar region and encased in the renal fat pad. So around the kidney there is a pad of fat to protect your kidney. So introduction, these are the paired organ bean-shaped retroperitoneal in lumbar region from T12 to L3 vertebra. The size of kidney is approximately 11 to 14 cm in length and 5 to 6 cm in width. That is the size of kidney approximately. It consists of cortex and medulla. The functional unit of kidney is nephron. There are millions of nephron in the kidney. Nephron consists of glomerulus, that is the filtration part, and tubular part, tubular system. Tubular system means proximal convoluted tubule, then distal convoluted tubules, then loop of Henle, and collecting duct. That is the tubular system of kidney. So nephron consists of glomerulus plus tubular system. These tubules, they merge into the duct of Bellini at the apices of papilla of the kidney, which open into calyceal system. This calyceal system form renal pelvis, and this renal pelvis continues as ureters. So that is the histological part of your kidney. So there are millions of nephrons in kidney, consist of glomerulus, which is the filtration part of kidney. The blood is filtered here, and then tubular system, proximal convoluted tubule, distal convoluted tubule, loop of Henle, collecting duct, all the merges into duct of Bellini at the apices of papilla of the kidney. These papilla then form calyceal system or open into calyceal system. This calyceal system form renal pelvis, and renal pelvis continue as ureter. So ultimately the urine which is formed is drained into ureter and then ureter to bladder. So formation of urine from pelvis to ureter and then to bladder. The glomerulus consists of tuft of capillaries, that is afferent and efferent, surrounded by Bowman's capsule. The filtration part consists of fenestrated endothelial cell layer of the capillary, the basement membrane of the capillary, and the epithelial podocyte cell layer around that with food processes. So endothelial cell, basement membrane, and epithelial podocyte cells with food processes, these three constitute the filtration part of your kidney. So this is the in short introduction about your kidney. Then and then only you can understand about the nephrotic syndrome. So before that you should know little bit about anatomy, physiology, and histology of the kidney. So this is the functional unit of kidney, that is called as nephron. This is the glomerulus part. This glomerulus consists of tuft of capillary, that is the network of capillary. Tuft of capillary means network of capillary, which is formed by afferent arteriole and efferent arterioles. Around that there is a Bowman's capsule. So this is the Bowman's capsule. Then it continues as tubular system, that is the proximal convoluted tubule. So it is the filtering part of the kidney, that is the glomerulus. So this is the Bowman's capsule and this is the tuft capillary together from glomerulus. So the glomerulus is surrounded by Bowman's capsule. It is the network of capillaries that perform the first step of filtering the blood. It operates as a non-specific filter. It removes both useful and non-useful material. So this is the histological or the section of kidney. See this section. In this section, see this is the renal pelvis as we discussed, which continues as ureter. This is called as hilum part, where the renal artery and the inferior vena cava come and out. That is the hilum part of the kidney. These are called the papillary part. These are called papillary part where the duct of Bellini open, as we discussed. These are the renal papilla where the duct of Bellini open. These renal papilla open into calyceal system, major calyces and minor calyces. See, these are called minor calyces. These are called major calyces. So these papilla they open into calyceal system, and in the papilla open duct of Bellini. So duct of Bellini open into the renal papilla. Renal papilla open into major and minor calyceal system. Calyceal system from renal pelvis, and renal pelvis continues as ureter. So this is the cortex part. Outer part is called as cortex part. This inner part is called as medullary part of the kidney. So the main part are cortex and medulla. Medulla consists of this papilla, calyceal system, and in between these are called as renal pyramids. In between they are called as renal pyramids. So cortex, medulla, renal pyramids, major calyces, minor calyces, renal columns, outer layer of fibrous capsule. So this is the section of kidney for your understanding. Papilla, hilum, pelvis, adipose tissue, fat. So kidney is surrounded by pair of fat. So this is adipose tissue, renal sinus, inner layer of fibrous capsule, outer layer of fibrous capsule. So this is the section of kidney for your understanding. This is just for your understanding. It is not asking exam, but without this you won't understand about the nephrotic syndrome. See, this is the nephron. This is the glomerulus, tuft of capillaries surrounded by Bowman's capsule, which continues as proximal convoluted tubule. The first comes proximal convoluted tubule, then come descending loop of Henle, then come ascending part of loop of Henle, then come distal convoluted tubule, and then come collecting ducts. So this is the collecting duct. So, network of capillary surrounded by Bowman's capsule. This is from glomerulus, then which continues as proximal convoluted tubule, then continue as descending loop of Henle, then ascending loop of Henle, then the distal convoluted tubule. Here it comes from here, proximal convoluted tubule, descending part, loop of Henle, ascending part, distal convoluted tubule, and which continues as collecting duct. Collecting duct they open into duct of Bellini. Duct of Bellini open into renal papilla. So this is the structure of your kidney or the functional part of kidney, that is nephron. The glomerular filtration membrane that consists of three layers, as we discussed, the endothelial layer of the capillary, then the basement membrane, and the podocytes, the epithelial podocyte with food process. So the fluid that filtered from the capillary blood into the Bowman's space. The filtering part is collected into Bowman's space is called the filtrate, and it forms the primary urine. So what are the functions of your kidney, or what functions your kidney is doing in body? So main function is urine formation or the excretory function. Our kidney's main function is excretory function or formation of urine, excretion of waste product. Then regulation of electrolytes, sodium, potassium, calcium, magnesium, etc. So regulation of electrolytes. Which are the electrolytes? Sodium, potassium, magnesium, calcium. They are called as electrolytes. So regulation of electrolytes level in body, regulation of acid-base balance in your body, then control of water balance, then control of blood pressure by secreting renin and Barras system, then clearance of drugs, toxins, as it is a excretory system. So clearance of drugs and toxins. So excretion of drugs and toxins. Then regulation of RBC production by secreting erythropoietin. So without secretion of erythropoietin, there is no red cell production. So erythropoietin secretion, that means a hemopoietic factor. Then hemopoietic growth factor. Synthesis of vitamin D. Vitamin D, we already know that synthesizing first part in skin and then second part in kidney. So synthesis of vitamin D to its active form, that is 125 hydroxycholecalciferol, which is synthesized in kidney, and secretion of prostaglandins. So the main function: urine formation, excretion of waste product, regulation of electrolytes, acid-base balance, water balance, maintenance of blood pressure or control of blood pressure by renin and by RAS system, renal clearance of drugs and toxins, the regulation of RBC production by secreting erythropoietin and synthesis of vitamin D. These are the major functions of kidney. Now, what is nephrotic syndrome? So, we discussed little bit about anatomy, physiology, histology, the section of kidney, everything, and the functions of kidney. Now, we proceed for nephrotic syndrome. Nephrotic syndrome is a primary glomerular disease. It is a glomerular disease. Understand, the functional part of kidney is nephron. Nephron consists of glomerulus and the tubular system. So we are mainly dealing with the glomerular part of kidney. We are mainly dealing with glomerular part of kidney in nephrotic syndrome. Glomerular part means the glomerulus, which is formed by tuft capillaries, afferent and efferent, surrounded by Bowman's capsule. There is a Bowman's space, and then continues as tubular system. So we are mainly dealing with this glomerulus with filtration part. Means we are mainly dealing with filtration part of kidney or the filtration membrane of the kidney, which is very very important. So it is a primary glomerular disease. It is not disease of tubules. Means here tubules are not affected. Only glomerulus is affected, or only disease related with the glomerulus. So it is a primary glomerular disease characterized by proteinuria. There is loss of protein in urine. Proteinuria means loss of protein in urine. Because of that, there is hypoproteinemia, decreased protein level in your blood. That results in edema. We discussed already in edema in general examination in practical part that hypoproteinemia is one of the cause of edema because it causes decreased oncotic pressure. If protein levels are less in body, it is called hypoproteinemia. Hypoproteinemia decrease oncotic pressure, that is the pressure because of protein. If there is decreased oncotic pressure, there will be edema, that is collection of fluid in the interstitial spaces. So there is proteinuria, loss of protein in urine, that leads to hypoproteinemia, that leads to edema. And hypercholesterolemia, increased cholesterol level, increased lipid level. Hypoalbuminemia, that is in short hypoproteinemia. Hyperlipidemia or hypercholesterolemia is same. Then because of gross proteinuria, serum albumin is low, less than 2.5 gram per cent. Because of gross proteinuria, serum albumin is low. So basically the problem is proteinuria in nephrotic syndrome. That is loss of proteins causing decreased level of protein, decreased oncotic pressure and edema. Then simultaneously there is increased synthesis of lipids. So that leads to increased levels of cholesterol and lipid in your body. That is called hypercholesterolemia and hyperlipidemia. So these are the basic problem in nephrotic syndrome. The main problem is proteinuria, loss of protein in urine. That is the main problem in nephrotic syndrome. So the main features nephrotic syndrome: proteinuria, loss of proteins that leading to hypoalbuminemia, that is loss of albumin or decreased albumin level in body, with simultaneous increased synthesis of lipids because proteins are lost. So for energy purpose, your body synthesizes more and more lipids. Your body cannot utilize proteins for calorie production. So if there is no protein for calorie production, your body try to synthesize more and more lipids. That is lipoprotein part in the body for calorie production. So there is hyperlipidemia, hypercholesterolemia. So increased lipid production, increased synthesis of lipoproteins. Then hypercoagulability, hypertension is there, edema is there, and these patients are prone for infection. These are the features of nephrotic syndrome. Remember, these are very important features of nephrotic syndrome: proteinuria, hypoalbuminemia, hyperlipidemia, hypercoagulable state. Hypercoagulation means blood clot very early, formation of blood clots, hypertension, edema, and prone for infection. So nephrotic syndrome is one of the cause for edema. Nephrotic syndrome is one of the cause for hypertension in secondary hypertension. In secondary hypertension. So it is important cause of hypertension, important cause of edema, important cause of proteinuria. And these patients are very prone for infection. These are the main features of nephrotic syndrome. Classification nephrotic syndrome depending on etiology, primary and secondary. Primary means the disease, intrinsic disease of kidney. Nephrotic syndrome resulting from intrinsic disease of kidney, that is diseases of glomerulus. Nephrotic syndrome resulting from diseases of glomerulus, that is the intrinsic disease of kidney. So it is called as primary nephrotic syndrome. Then it is called primary nephrotic syndrome. Secondary means secondary to systemic diseases. Means systemic diseases or other systemic diseases causing damage to your kidney and causing nephrotic syndrome. Then it is called secondary nephrotic syndrome. So being a renal manifestation of systemic general illnesses means any systemic disease like autoimmune disease damaging your kidney or diabetes damaging your kidney and that results in nephrotic syndrome. Then it is called as secondary nephrotic syndrome. So primary and secondary, that is the classification of nephrotic syndrome. Now, which are the primary causes? Means intrinsic renal diseases which are damaging your glomerulus and resulting in nephrotic syndrome. So, primary intrinsic diseases are minimal change in nephropathy, which is very common in children, 70 to 90% of children, and 10 to 15% of adults. Then focal segmental glomerulosclerosis, 15% in adults, membranous nephropathy, mesangial proliferative glomerulonephritis, and rapidly progressive glomerulonephritis. See, all these are affecting your glomerulus, that is the filtration part of kidney. All they are affecting glomerulus. So all these are the glomerular diseases. All these are the glomerular diseases, primary intrinsic diseases affecting the glomerulus, affecting the filtration part of kidney and results in nephrotic syndrome. So minimal change nephropathy, very common cause in children. So nephrotic syndrome actually common in children, and this minimal change nephropathy is the very common cause of nephrotic syndrome in children. Then focal glomerulosclerosis, membranous, mesangial proliferative and rapidly progressive. Now secondary causes means secondary to diabetes, damaging your kidney. Lupus erythematosus, it is an autoimmune disease damaging kidney. Amyloidosis, it is a storage disorder, deposits of amyloid. Then other viral infections like hepatitis B, HIV, hepatitis C, all they also causing damage to kidney and results in nephrotic syndrome. Even malaria fever, damaging kidney and results in nephrotic syndrome. Then preeclampsia in pregnancy because of hypertension. So these are the secondary causes. So main causes diabetes, autoimmune diseases like SLE, amyloidosis and viral infections like hepatitis B, HIV, hepatitis C and malaria fever, etc. Certain drugs, toxins also. Many drugs and toxins which are toxic to your kidney. These are called nephrotoxic drugs. So many drug toxin, if damaging your kidney, that also results in nephrotic syndrome. Sometimes heavy metals like lead, mercury, arsenic, they also damaging the kidney and that leading to nephrotic syndrome. So drugs, toxins, heavy metals, malarial fever, viral infections, storage disorders, autoimmune diseases, diabetes, these are the systemic diseases. All these are systemic diseases causing secondary damage to kidney, that is the mainly the glomerular part of kidney and that results in nephrotic syndrome. So these are the secondary causes of nephrotic syndrome. So primary intrinsic renal disease and secondary to systemic disease. This is the nephron part we already discussed. This is the glomerulus, tuft capillary, afferent and efferent surrounded by Bowman's capsule. There is a Bowman's space. Then there is a proximal convoluted tubule. This is the descending limb of loop of Henle. This is the curved ascending limb of loop of Henle. Then continues as distal convoluted tubule. Distal convoluted tubule continues as collecting duct. Collecting duct with open into duct of Bellini, which open into renal papilla. Renal papilla open into calyceal system. Calyceal system ultimately form renal pelvis. Renal pelvis continues as ureter and ureter open into urinary bladder. So that is the your pathway of urine. So the first urine from here and collected in the Bowman space. Then that filtering part or whatever is filtered, primary urine, is circulating through the tubular system. That urine is circulating through tubular system where secretion and reabsorption occur. Means the waste product is removed, secreted, and some electrolytes or water or whatever the body need is reabsorbed again while the filter is passing through this tubular system. So here the reabsorption and secretory function occur and final urine is formed. Reabsorption means the part which is important for body, some electrolytes, some water, some acid, that is reabsorbed, and the waste part is excreted. So final urine is formed here when filter is circulating through the tubular system. So this is your nephron. Now why there is proteinuria in nephrotic syndrome and why there is protein loss in nephrotic syndrome? Normally there is no protein loss. In normal healthy person there is no protein loss, but there is heavy proteinuria or increased amount of protein loss in urine in nephrotic syndrome. Now why this proteinuria occur or why this protein loss occur? The glomerular structural change. For proteinuria to occur, there should be damage to glomerulus, the filtration part of kidney. There should be damage to filtration part of kidney. So the glomerular structural changes that may cause proteinuria is damage to the endothelial surface, the damage to basement membrane or the damage to epithelial cells or the podocytes. The glomerular hemodynamics, that is increased intraglomerular pressure called as intraglomerular hypertension. There is hyperfiltration that can alter glomerular permeability. So first is damage to filtering part of kidney, damage to the filtration membrane or damage to the glomerulus that results in increased loss of proteins in urine. So many times this loss of protein or excretion of protein is selective. Selective means only some proteins are lost, then it is called as selective proteinuria. Excretion of relatively low molecular weight proteins like albumin and transferrin, then it is called selective proteinuria. If there is excretion of relatively low molecular weight proteins like albumin and transferrin, then it is called selective proteinuria. While if excretion is predominantly of high molecular weight protein like immunoglobulins, alpha 2 microglobulin, then it is called non-selective proteinuria. Then it is called as non-selective proteinuria. So it is also related to lead to damage of glomerular filter. So selective proteinuria, non-selective proteinuria. Two type of proteinuria. This increased loss of protein in urine is mainly because of damage to glomerulus or damage to filtering part of kidney, which allow the proteins to loss in urine. So normally, this filtration membrane of kidney is not allowing protein to filter, is not allowing protein to filter and lost in urine. So only a very small molecular weight some material or the particles are filtered through the filtration part. So proteins normally not excreted in urine. Your filtration member is not allowing the protein to lost in urine. But if there is damage, then there will occur increased loss of proteins or proteins lost in urine. Then it is called proteinuria. Now, why there is edema in nephrotic syndrome? As we know, there is loss of proteins, that means reduced albumin, reduced oncotic pressure, that lead to edema. Another mechanism is there is reduced blood volume. Because of edema, the fluid is coming in the interstitial spaces. Means the fluid is coming from intravascular space to extravascular space. So there is decreased intravascular volume. The intravascular volume is decreased, so that reduces your blood volume. If blood volume is reduced, there will be decreased perfusion of kidney. There will be decreased perfusion of kidney. If there is decreased perfusion of kidney, there will be less blood volume in the kidney that stimulates secretion of renin. That stimulates secretion of renin. Whenever intravascular volume is depleted, whenever intravascular volume is depleted, it always stimulates renin secretion. Always stimulate renin secretion. Then renin in turn stimulate your RAS system, that is renin angiotensin aldosterone system. This renin angiotensin aldosterone system is responsible for salt and water retention. It is responsible for salt water retention. With simultaneous, there is increased secretion of antidiuretic hormone also. Simultaneously increased secretion of antidiuretic hormone also. So these two, antidiuretic hormone and the RAS system, results in salt water retention, and that results in edema. So there are two mechanisms of edema in nephrotic syndrome. One is because of hypoproteinemia and second is because of stimulation of RAS system. So both contribute to edema in nephrotic syndrome. See, liver increases the production of lipoproteins, that is cholesterol and triglycerides, because there is hypoproteinemia. This hypoproteinemia stimulates your liver to synthesize more and more lipoproteins, and that results in hyperlipidemia, hypercholesterolemia and hyperlipidemia. Now, why these patients are more prone for infection? We see in main features of nephrotic syndrome that these patients are more prone for infection.